When it comes to introducing your overhead squat with pelvic organ prolapse, there's a few key things to remember. First, we need to go back and make sure that you've mastered your ABCs: alignment, breathing, and coordination with movement, right? This is quite advanced for a lot of people. So we want to make sure that your pelvic floor is in a place to take on this kind of impact. We also want to make sure that you have enough strength and coordination to be able to pull this off. So we want to make sure that you've strength trained and incorporated strength training in addition to your pelvic floor muscle training when doing an exercise like this one. You may also need to consider upper body and lower body mobility because it all plays a role in how you manage your symptoms. So if you're feeling ready to introduce this overhead squat, go for it. But a key tip here is just to start with a light load and then gradually add on 5 to 10% to see how well you can tolerate it. If you do run into symptoms, again, check alignment, breathing, and the coordination of your pelvic floor with movement or with the exercise, and go from there. If you can only start with a light load before feeling symptoms, that's okay. You've got some stuff to work towards, which makes this a really exciting process. So when bringing your arms up overhead in your overhead squat, we want to make sure that we can keep our nipples in line with the wall. If they're thrusted upwards, that pushes your diaphragm behind your hips when we want to maintain that stacked rib position. So ribs over your hips, okay? On the flip side, we also want to avoid caving downwards with our upper body or our chest. So we do not want our nipples pointing to the floor, okay? Straight ahead. This is because, again, we want to make sure that your ribs are in line with your hips. If you're rolling forward, then what happens is now your pelvic floor is no longer in line with your diaphragm and they're not able to work together to manage or effectively manage that prolapse, right? So we're working with intra-abdominal pressure here. We're working with your diaphragm, your pelvic floor, mobility, as well as core strength. Ready to do this? Let's go. But once you're there, the sky is the limit.